Assalamualaikum dear students, welcome to your channel The Anatomy Canvas. In today's class we are going to discuss the humerus. So humerus is the longest bone of the upper limb, and just like other long bones it has two ends and a shaft. So upper end is little bit, it is rounded medially. This is the upper end. It has an head, and this head is about 1/3 of a sphere. It is directed medially and backward. Then this upper hand is separated from the rest of the bone by a constriction, which is called the anatomical neck of the humerus. Then at the anterior aspect, you can see a tubercle over here, which is called the lesser tubercle. And on the lateral side of this, you can see another tubercle, which is called the greater tubercle. This greater tubercle has three facets: the superior facet, the medial facet, and the inferior facet. Between these two tubercles, the greater tubercle and the lesser tubercle, there is a groove which is called intertubercular groove or bicipital groove. This groove has the medial lip and the lateral lip. This groove lodges the tendon of the biceps muscles along with the ascending branch of the anterior circumflex humeral artery. This groove is bounded by the transverse ligament. So this is the head of the humerus. This is the lesser tubercle, the greater tubercle, the three facets, the superior, middle, and inferior facet of the greater tubercle. Then the anatomical neck, which is a constriction which separates the head from rest of the upper end, and this is the location of the anatomical neck. Then you can see the intertubercular sulcus, also called the bicipital sulcus. This upper part or upper end of the humerus is separate from the rest of the shaft by the surgical neck, which separates this upper end from the rest of the shaft. And this surgical neck is very important because on its posterior aspect the axillary nerve is passing, and this axillary nerve is supplying the deltoid muscles. And with fracture of the surgical neck of the humerus, this axillary nerve is damaged. So this is an important clinical correlation. Now we discuss the shaft of the humerus. This humerus has three borders and three surfaces. First of all, the anterior border, which starts from the lateral lip of the intertubercular sulcus, and it goes downward till it ends over here. In upper part it is prominent, where it is from the medial lip or anterior lip of the deltoid tuberosity, and lower part it is somewhat rounded. Then the medial border is formed by the medial lip of the intertubercular sulcus. It goes downward and it is continuous as the medial supracondylar ridge. Lateral border, it is continuous as the lateral supracondylar ridge. This lateral border is sharp in its lower part, and it is barely perceptible in its upper parts, where it reaches the posterior aspect of the greater tubercle. In the middle part, there is the bicipital groove, or the radial groove is present. So these are the three borders: the anterior border, the medial border, and the lateral borders. Now we will discuss the surfaces. First of all, between the anterior border and the medial border, we have anteromedial surface. This anteromedial surface, in its upper part, it has the floor of the bicipital groove. And between the anterior border and the lateral border, we have the anterolateral surfaces, and in anterolateral surface, in its middle part, you can say this is the deltoid tuberosity, which is V shape, where the deltoid muscle is inserted, and behind this tuberosity is a radial groove through which the radial nerve passes. Then we have the posterior surface. Between the medial border and the lateral border, there is the posterior surface. Another point is, on the medial surface, you can see this is the nutrient foramen, which is present in the middle of the medial surface. Now we will discuss the lower end of the humerus. The lower end of the humerus, it has condylar in shape. It has both articular surfaces and non-articular surfaces. The articular surfaces of the lower part is, first of all, this is the capitulum, and this capitulum articulates with the head of the radius, and this is a pulley shaped area called the trochlea. This trochlea is about 6 millimeter below the capitulum and which is responsible for carrying angle of the elbow joint in the human beings. Then the non-articular surface, this one is the medial epicondyle, which is more prominent and it is subcutaneous. It can be felt in human body, and this one is the lateral epicondyle. Above the medial epicondyle is the medial supracondylar ridge, and above the lateral epicondyle is lateral supracondylar ridge. On the posterior aspect, we have a fossa, and this is called the olecranon fossa. This fossa is just above the trochlea and it lodges the olecranon process of the ulna. Similarly, on the anterior aspects, we have two depression. The one is the coronoid fossa, which is just anterior to the trochlea, and this fossa lodges the coronoid process of the ulnar bone during the flexion of the arm. Similarly, this is the radial fossa, which lodges the head of the radius during the flexion of the elbow. Side determination of the humerus. First of all, you can see the upper part of the shaft is rounded and lower part is triangular. The upper end has a head or head which is present medially, and also look at the lower end which has a lateral supracondylar ridge which is more prominent. Similarly, the medial epicondyle is prominent. So by looking at the position, this is the medial end, this is the anterior aspect of the humerus, this one is the lateral and medial side. So this is the humerus of the right side. And similarly, look at this bone. This one is the medial end where the head is present. This is the anterior surface, and here you can see the lesser and the greater tubercle and bicipital groove over here. And at the lower end you can see this one is the lateral supracondylar ridge which is more sharp, and also you can see the medial epicondyle which is more prominent and subcutaneous. So this one is the bone of the left side and this is the bone of the right side. So this is the side determination of the two bones. Discuss the muscles attachment of the humerus. First we will discuss muscle which are attached to the upper end. So this is the lesser tubercle and the greater tubercle. At the greater tubercle we have discussed that it has three facets: the superior facet, the middle facet and the inferior facet. So at the superior facet the supraspinatus is attached, then the infraspinatus is attached, and then the insertion of the teres minor muscle. And at the lesser tubercle you can see this is the subscapularis which is inserted. So these four muscles are the muscles of the rotator cuff, and mnemonic for this muscle is SIDS: supraspinatus, infraspinatus, teres minor and then the subscapularis. The three of these muscles are inserted into lesser tubercle, and one of these is inserted into the three are inserted into greater tubercle and one are inserted into lesser tubercle. Then the upper end of the shaft, here you can see this is the bicipital groove, and this is the lateral lip of the bicipital groove, and this one is the medial lip of the bicipital groove. At the lateral lip of the bicipital groove, the pectoralis major muscle is attached, and at the medial lip there is the teres major muscle which is attached. These are the insertion point of pectoralis major and teres major muscle, and in the floor you can say this is the insertion of the latissimus dorsi muscle. So these three muscles are present, their insertion points are present over here. Then we move on to the anterior aspect of the shaft, and here in over here you can see this is the origin of one of the long muscle, largest origin. This is mainly present on the lower half of both anterolateral and anteromedial surface. There is the origin of the brachialis muscle. Also, by moving on to the medial aspect, you can see there is the insertion of the coracobrachialis on medial border in its middle part. Similarly, on the lateral aspect, you can see at the deltoid tuberosity, there is the insertion of the deltoid muscle. Now we move on to the lower end of the humerus. This is the medial supracondylar ridge, and this one is the lateral supracondylar ridge. So in upper two-thirds of the lateral supracondylar subcondylar ridge, you can see there is the origin of the brachioradialis muscle, and at the lower part you can see there is the origin of the extensor carpi radialis longus. Similarly, on the medial supracondylar ridge, you can see here is the origin of the pronator teres muscle, and this area is a common origin for the all the flexor muscles of the forearm. So this is called the common flexor origin. Now we move on to the posterior aspect. So on the posterior aspect, there is a roughened surface over here on the posterior surface where it gives origin to the lateral lip of the triceps muscles, while medial lip of the triceps muscles arises from the major part of the posterior surface. So here is the bicipital groove, a radial groove which is present, and above the radial groove is in origin of the lateral head, and below the radial groove you can see there is the origin of the medial head of the triceps. Now moving on to the posterior aspects, the lower end, here you can see on the posterior aspect of the lateral supracondylar ridge, you can see there is the origin of the enconius muscle, and this area is the roughened area for all of the muscles of the extensor compartment of forearm, where we give it a name of the common extensor origin. So these are the different muscles. Now a quick revision. First of all, the upper end, the supraspinatus, the infraspinatus, the teres minor on the greater tubercle, and on the lesser tubercle, these are the subscapularis. Then at the medial lip and lateral lip, you can see this one is the pectoralis major, the teres major, and in the floor you can see latissimus dorsi. On anterior aspect, you can see the origin of the brachialis muscle, and on medial border in its middle part you can see insertion point of the coracobrachialis. Similarly, on the lateral border you can see at deltoid tuberosity there is insertion of the deltoid muscle. So at the lower end you can see in upper part this is the brachioradialis, then the extensor carpi radialis longus, then the enconius, and then the common pronator teres and the common flexor origin. Now move on to the posterior aspect. You can see this is the lateral head of the triceps, the medial head of the triceps, and here you can see enconius and common extensor origin. So these are all the muscles attachment of the bone. Allah Hafiz till the next class.